We're going to show you a dry needling technique for needling the multifidus muscles along the side of the spine, either in the lumbar or the thoracic region. These little guys, these are tiny little muscles, hide deep in that laminar groove underneath our rectus spinae muscles. Very, very important muscles for spinal stabilization, maintaining control through rotation in the spine. When they get tight, they do very much limit our ability to flex and extend through the spine. So we're going to show you how to safely and effectively needle the multifidus muscles in the spine. Alright, now we're going to needle the multifidus muscles either in the lumbar spine or the thoracic spine. The process for needling through these areas is essentially the same. Again, people get a little bit worried about needling in the thoracic region because of the lung. When we think about the orientation of the muscle and its location, it's actually very safe because of where it sits. So the multifidus muscles will extend from a spinous process and down an angle to the transverse processes below, either one segment or two segments below, depending on where you are in the spine. So each of these little muscles, as they extend off the side of the spine, create like little arrowheads, almost like a Christmas tree as it comes down each side. So it's sometimes difficult to palpate them individually, but if you do a cross fiber gliding technique with your fingers, sometimes you can feel yourself kind of roll over the tissue. And if we look at where the rectus spinae muscle is, we know that that runs longitudinally. So if we're running longitudinally with our glide and we're getting a flicking sensation of a tissue that's running obliquely across that area, then it can't be the rectus spinae, it must be something else. And in most cases, we'll be able to pick out the multifidus or even the rotatories by doing that side-to-side movement. So if we can find that tissue, that muscle, from a spinous process to a transverse process, we know that the middle of that belly is going to be central, pretty much right in the middle of that laminar groove, which is the safest place to needle when we're near the spine. If we direct the needle down into the laminar groove, we hit bone. We're nowhere near a nerve root, we're nowhere near the lung field either. So from here, it's pretty simple. We need to swab that area, and then we'll insert that needle either perpendicular straight down or slightly angled towards the base of the spinous process. We don't need a long needle, so a 30mm needle is going to be plenty for this one. So we identify a spinous process. We then imagine that projection of the multifidus as it comes down obliquely out on an angle to the transverse process below. We angle that down into that laminar groove. As you can see there, my finger is right on the spinous process, and I've come out maybe ½ centimetre. At that point there, it's actually quite safe to go vertically down into that space, but if you want to be ultra safe, angle the tip of the needle slightly medially towards the base of the spinous process, that laminar groove. Tap the needle in, and then we can go straight down into, we've got a little twitch, that's good, straight down in towards that laminar groove. And you can see that's a 30mm needle. I'm about 20–25mm in, and I've still got plenty of space to play with in that tissue there. And that's how we would hit multifidus.